Hi. At Angelic Lift, for the past 15 years, we've dedicated ourselves to helping people achieve their weight loss goals and improve their overall health inside and out. Today, I want to talk about an exciting development in weight management: GLP-1 agonist medications such as Ozempic, Mounjaro, Wegovy, and ZepBound. These medications work by mimicking the GLP-1 hormone in your body, which helps regulate appetite and blood sugar levels. Think of it like your sidekick that tells your brain that you are full after just eating half of your plate. It also helps you remain full for several hours, killing all that food noise, so you don't feel the need to snack between meals or late at night. This class of medication have been a game changer since they were first discovered back in 2005. The FDA first approved Ozempic in 2017 and Mounjaro in 2022 for diabetics, and quickly saw how well it helped those patients achieve blood sugar control while losing weight at the same time. Subsequently, the FDA approved Wegovy in 2021 and ZepBound in 2023 for those patients who were not diabetic but simply needed to lose weight. As of 2024, it's estimated that millions of patients worldwide are using GLP-1 drugs for weight loss and diabetes management. These medications, which include Semaglutide generic of Ozempic, Wegovy, Tirzepatide generic of Mounjaro, ZepBound, have seen a significant surge in usage due to their effectiveness in promoting weight loss and controlling blood glucose levels. Many patients in our practice have also chosen these drugs as their tool, helping them lose weight effectively and keep it off. The most common side effects we see with these meds: vomiting, constipation, and/or diarrhea. Government health plans such as 𝐜𝐨𝐤𝐵E now covers Wegovy for patients with a history of heart attacks, stroke, and peripheral arterial disease, because the latest clinical research showed risk reduction in major adverse cardiovascular events, MACE, which means it reduced the occurrence of serious cardiovascular issues such as heart attack, myocardial infarction, stroke, and cardiovascular death by a significant 20%. When a patient comes to us seeking help with weight loss, we start with a comprehensive evaluation. We discuss their medical history, lifestyle, and weight loss goals. It's important to understand that weight loss isn't just about looking good, calorie in, calorie out. It's about feeling good, improving your health, and preventing future diseases and risks. It's about correcting hormonal imbalances, managing stress, addressing nutritional and vitamin deficiencies, unveiling autoimmune issues and food sensitivities, fixing malabsorption issues in the gut, and removing food allergens. One of the biggest concerns patients have is the cost of these medications. That's why we work closely with each patient to see if we can get coverage through their insurance. Navigating insurance can be tricky, but with our experience and expertise in completing prior authorizations for many patients, we can often find a way to get these medications covered when patients have a health plan that has these medications in their formulary. However, we understand that insurance doesn't always cover everything, or at times, the patient's estimated out-of-pocket portion is cost-prohibitive. That's why we also help our patients find affordable generic options like Semaglutide and Tirzepatide. These generics are just as effective since they use the same FDA-approved ingredients as the brand-name drugs. The generic versions are the more budget-friendly choice for many of our patients. Instead of a retail pharmacy like CVS or Walgreens, we send the prescription for the generic versions to a vetted and reputable local compounding pharmacy that can ship the medication within 2 to 3 business days directly to the patient's door. The results speak for themselves. Many of our patients have not only achieved significant weight loss, but have also improved their overall health, reducing risks associated with obesity like diabetes, heart disease, and stroke. If you're struggling with weight loss and looking for a solution that works, we are here to help. Together, we can create a personalized plan that fits your needs and helps you achieve your health goals. Don't let cost be a barrier. There are options out there, and we are committed to finding the best one for you. Contact our clinic today to schedule a free consultation. Let's take the first step toward a healthier, happier you.